If you guys don't know me, my name is Rick Horak. I do primary care sports medicine. I was an internist, and I went back in 2011 with Dr. Andrews and did a primary care sports fellowship. Up in Andrews, the primary care guys are the ones that did the concussions. Here in town, other than the ones at university with Dr. Goodlett and VCOM, I'm kind of it. So a lot of the concussions kind of go through me. The orthodox will take care of them, and I'm not trying to take away their business. But honestly, from a volume standpoint, I probably have seen a lot more than they have. I just got back from Chicago a month ago from a 3-day conference with the American College of Neurology, straight for concussions. I'm going to lettuce research and the return to play. And the biggest problem we run into kids, and this won't be an issue for you, is school. It's really hard because these kids get these concussions. And you know, the goal in theory was to keep them out and keep them down until they kind of healed up. We call it the cocoon theory. And now we realize that 2 to 4 days, we really need to get them back into school if we can. So we have to start balancing the symptoms they're having with what we think is a safe time to get them back in a school environment. I'll try to keep this quick. Does everybody know what a concussion is? What some people think a concussion is, generically?
Certain kind of brain injury with some kind of heat or some kind of bruise to the brain.
That's a good way to look at it, but it's kind of.
The body decelerates and the brain slams to the inside of the skull.
Yeah. So, and my point of asking the question is you could ask a room what a concussion is, you're going to get 99 different answers. And the point of the next couple slides is really, just to show that, this is the American College of Neurology's definition, right? The formal medical definition of concussion is it's a clinical syndrome characterized by immediate and transient alteration in brain function, including alteration of mental status and the level of consciousness resulting from mechanical force or trauma. And if you skip to another one, which is our governing body in primary care, sports medicine, American Medical Society Sports Medicine, their definition is a concussion is defined as traumatically induced transient disturbance of brain function and involves a complex pathophysiological process. Concussion is a subset of mild traumatic brain injury, which generally is self-limited and is less severe, and it's at the less severe end of the brain injury spectrum. So even in the academic world, the theory of a concussion, or the definition of concussion varies, but it all comes back to is some sort of disruption within the brain. It's a pathological process, and it's very, very complicated. It is considered mild TBI, not severe TBI, where there's like severe loss of consciousness, amnesia, that kind of stuff. But now because it's mild doesn't mean it doesn't cause any long-term problems, which we're aware of. And why all the fuss? Basically just because the number of concussions is going up. We have 300,000 concussions that were diagnosed in 1999, and then you get up to 2009, it was 3.8 million. And I haven't seen any recent research in terms of the number of concussions over all sports. But that's kind of the one, if you read articles, we still kind of fall back to that one central 3.8 million. 50% of the athletes never report them. You guys are all U10 and up, correct, coaches? So this is where it's going to start getting complicated. The last group was 6 to 8. Kids aren't that physical yet. We start getting U10, they said they're going to get their growth. They're starting to get testosterone. They're starting to get their growth spurts. This is where you're going to start seeing the injuries come down on the soccer field. I didn't get hurt until I was, 16 playing soccer. So, and the biggest thing I put this slide up here for a reason is it came out in 2015 in JAMA, but they actually looked at incidents in soccer. And it was a big article. And they looked from 2005 to 2014. And they had 627 concussions were diagnosed among girls, and they had 442 diagnosed among boys. So from that, they were get a better idea of the incidence per 10,000 athletes, they came up with 4.5 concussions for a girl per 10,000 and 2.8 among boys. It also mentioned that girls have longer concussions, and they tend to have a higher incidence on what you see. And that's something like clinical practice. That correlates right to what we do. In clinical practice, our girls tend to be more symptomatic when they come in. The concussions last longer, and the boys tend to get better a little quicker, and we don't understand why. It's also age-induced. The younger kids take longer to get better than the older kids. Probably has something to do with the fact their brain's still developing. It's much more susceptible to the impact. And it is a clinical dilemma. It's a major health problem, and the severity of the long-term effects are not well known. Right now, there's something called the CARE Consortium, which is just starting up, and I believe it's 40 colleges across the United States that are involved. And they are working with them as well as the Department of Defense to look at concussions over the next 5 years. So they're going to track these injuries for 5 years out. And that may give them a little better idea of the long-term effects and as well as the immediate effects from concussions. So there has much more coordination between the two. The military is very interested in it because of the fact that during the war, we had a large problem with mild TBI. Initially what happened was you had the IEDs, and the IEDs would just blow up the Humvees or whatever it was, and or it's traumatic injury, it's amputations, that kind of stuff. So we got smart, and we armored up the Humvees, armored up the Bradleys, and all of a sudden the soldiers survived the blast, but they're still just being jolted around in the Bradley on the explosion. And they were getting these concussions from it. We didn't think much of it. They were going back out to the field to fight the next day, all that kind of stuff. And, unfortunately, we started seeing they came home. We started seeing drug problems, divorces, changes in their behavior that weren't there before. And I know some of it is, because they went to war, but a lot of it, we started looking at any soldier survived 3 to 4 IED blasts. Anybody more than that, they started getting concussions. I know I took care of one athlete, a soldier who had survived 14 IED blasts. And he would go back every day, same thing. Now the military's gotten smart, and they try to assess the guys a little better after they get in those situations. But initially during the war, they just sent them back out the next day. It was no delay whatsoever. True story is a friend of mine was a PA. He actually guarded Condoleezza Rice during her day. And at one point before he was a PA, he was Marine Recon. And he said they were out in patrol one day, and their vehicle, and a suicide driver decided to blow up be detonated early. And all it did was knock over their Humvee. And they said they got up, he was dead, and we picked up our pieces and went on. So there was no downtime for these guys. It wasn't like they wanted to look and see if they were injured from it. And right now, it's just kind of athletes everywhere. Approximately 30 million kids around the United States play some sort of organized sports. And that doesn't even touch on the fact that we have a lot of extreme sports, skateboarding, all the other stuff that goes on. Is it all about football? I've kind of mentioned that real quick. Yes, football has a high incidence, 6 per 10,000, but you saw from that recent study, it just came out, it was 4.5 to 2.8 respectively for soccer for boys and girls. And once again, what is a concussion? It's basically a mild traumatic brain injury. It's invisible, and it gets very, very complex, and I won't even go into it, the complex pathophysiological. You've got calcium changes, sodium changes, you've got glucogen and all that stuff that's going to the brain and not going to the brain afterwards, and it evolves over a couple weeks. Cause of concussion, like I said, it doesn't always have to be from whatever. It can be from a jolt to the head from just hitting the ball. It can be run into another player, hitting the goalpost. Hitting the ground really hard, when they try to just lose their balance or go up for something, they jump together. So that you have to kind of just have a high index of suspicion for if they have a concussion or not. And the reason being is, this is the big point of this slide, and what I try to cut down to really quickly for y'all is the hard part here is you hear a lot of things out there that they're trying to make concussion-proof helmets. In soccer, they have the headbands they wear to try to cut down concussions. You'll see mouth guards that will cut down on concussions, that sort of stuff. All of that really can't do one thing. And what it can't do is cut down the rotational forces on the brain. Your brain's not fixed within the skull. So when you get hit, you've got a linear acceleration, you've got rotational acceleration. And it's that rotational acceleration that does the concussion. And that's the one that we, to this day, don't know how we're going to stop. So when they have these concussion-proof helmets, none of them can stop the rotation, and thus they're still not going to be concussion-proof, even all the research going into it. And I think I have not done any recent studies into it, but I think the girls wearing the soccer bands and stuff, it's really been shown not to be any help whatsoever in reducing the incidence among girls. So what I tell a girl not to wear it, if she wants to, it's great. It's not going to hurt her. But is it going to stop her from getting a concussion? No. So, and I said, don't be fooled. This is serious, right? That's obvious. But it's a kid that just kind of jumps up and barely collides with the kid or took a small elbow. Those are the ones, and sometimes even the small hits can probably be the hardest ones. I can say from Saturday afternoons in clinic that my kids that get hit really hard, sometimes they come in Saturday and they're great, I'm afraid, And it's the kids that just kind of got jolted a little bit and they come off and they're kind of a weak diagnosis of a concussion, we think. And they're just go on for days and a week or weeks and weeks for not getting back. And they have constant headaches, they're constant dizzy. They look at the computer screen for 5-10 minutes and they can't focus anymore. So sometimes the simplest of things ends up being our more difficult ones to manage. And I like to put this up here. I think everybody used to know years ago, it's a mild concussion, severe concussion. We like to say now there's no such thing. It's just a diagnosis of a concussion. And it doesn't change how we manage them in the long run. Want to seek medical attention, really honestly, for a sense of coaches, anybody that it's going to be easier on you guys because you have trainers out there that are supplied. But honestly, anybody that has any loss of consciousness, any degree of seizure activity, those are the big things that you would want to immediately make sure they get attention for and go to the emergency room. The harder ones to know about the kids that you can't really tell much but they come off and they're saying they have a little bit of a headache. And this time of year, my hard part on Friday nights is how much this headache is driven from dehydration and how much this headache is actually a concussion. I will tell you, I rule on the side of safety. If they come off with a headache, I kind of say it's it for the night. And I kind of use some other tools, but I have a really low threshold for taking them out. Because this is high school. And I went to that conference, we had the NCAA director there, and the NCAA director said that, you have to keep these kids in line, make them professionals for life, because out of all divisions in college sports, 1, 2, and 3, only 1% of those kids ever go on to be professional athletes. And at the high school level, only 5 to 10% actually go on to college. So my goal on Friday nights is to keep these kids safe. Big things about initial management of concussion, you can tell your parents real quick. It's just for the kids that, you're not sure, has a little headache, he's not feeling right. For the first night or two, or first day, just kind of keep an eye on them. You don't have to wake them up every 2 hours, but just make sure somebody's gonna be around that house that night to kind of keep an eye on them, okay? The other thing I like to tell people is, just kind of give them some rest and then use Tylenol for pain. The headache you can treat. We try to tell people not to use Advil, Aleve. Is it probably gonna cause any damage? Probably not, but there is a theoretical possibility they could bleed from the non-steroidal. So we usually tell them to avoid the non-steroidal. So Tylenol typically in these age groups. And then make sure they call their pediatrician right away. What to look for, once again, I like to put this up here. You're the first line defense. You're gonna know at the first couple of practices, first couple of games, you're gonna know your kids that are real hard players. You know your kids that what their typical, personalities are like on the sidelines. And you're gonna start seeing changes in them. So you're just gonna have a low index of something's not right with this kid and ask them a few simple questions. Observe signs. If it comes up, they'll be dazed, confused. They may not know the date, may not know where they're at. A lot of times on Friday nights, and you can use it here, we're asking who they're playing, who's winning, what the score is. If they can't tell us that little bit, then we know, most of the kids are paying attention during the game. They should know those simple things. So for here, ask them where they're at, that kind of stuff, who their team name is. And if they're having problems relaying that to information, something's not right with that young kid. The signs and the symptoms are hard. Symptoms, once again, are vague. And the biggest one you're going to see in your kids is going to be headache. That's why I bring it up. Most of the kids will have some degree of headache. The other thing is you'll be dizziness. And if I have to tell you one thing with dizziness is that's your biggest clue if they got a concussion. So if you can't tell from if the headache's bad enough, any of your players that come off, and if you ever watch NFL college games from the future, just keep this in mind. Say a kid gets hit out there, right? And he's being helped off by his teammates and he's kind of wobbling like this. Yeah, it's not good. And we use dizziness as one of our main clues for a concussion. We do a lot of tests when they get in the office for dizziness. We have them do tandem stance. We have them lift one leg up and close their eyes. And we do all that kind of stuff to kind of measure this. So the dizziness is very early on a really common symptom. Loss of consciousness, as much as we think it would be there, it's not very common. So physical, basically it's headache, it's nausea, vomiting. Cognitive, they're going to be foggy. They're going to be they're going to have a kind of a hard time thinking things. You won't see it so much with, the schoolwork, but that's our biggest problem in the office is trying to get these kids back to school.
Does the dizziness warrant the parent calling the doctor immediately?
No, doesn't, but it's a clue to me when they come in and see me that they're going to have a longer concussion probably than the kid.
So next day go to the pediatrician.
Right. Like I said, the big thing for you guys, any loss of consciousness, seizure activity, I'm not moving my arm. Anything that looks like something bad's going on would be what you would clue on. The headaches, the dizziness, that kind of stuff is when you would just pull them from a game and say, look, you need to call your pediatrician or call my office and we'll get them in and get them seen. And once again, you have emotional things and you got sleep. A lot of the kids will have a hard time sleeping. Typically, they don't sleep too much. It's more difficulty sleeping. Emotional is these kids will get irritable. They cry. And for no reason at all. I mean, you have football players come in on Saturday morning and you talk about something from the game and they just get really upset and start crying there. Now for the boys, it's really kind of, unsettling for them. But that's just the concussion doing it. You have to kind of just reassure them. When you expect a concussion, it's pretty simple. And I kind of put this up here. It's simple. Just take them out. Don't risk on anything, okay? And return to play, and I'll go on this later on, and I'll say it right now. Return to play is an easy decision for you guys. It shouldn't happen. Return to play is a medical decision, and the trainers can't make it. The only person that can make the medical return to play is a doctor or a PA or something like that, but somebody that's a medical staff. So we're the ones that would have to evaluate them. So don't let a parent convince you or coerce you, oh, he's fine, this is just the way he is. Say, no, I'm sorry, I think he's got a concussion. I think he needs to sit out the rest of the game and be evaluated by a doctor in the morning, okay? And then as a coach, you're lucky because you don't have to worry about it, but some of the coaches will push the docs, like on Friday nights, they get a lot of push. And the only pressure you're gonna have, and you gotta remember this is rec, is parents. As you get closer and closer to the playoffs and to that playoff subset, you're going to maybe have a kid get a concussion, and you're going to have parents that, they've got to have little Johnny play because he's the star striker and he scores all the goals. Well, you got to remind him this is rec ball, and there's more important things than winning the championship in the U12 division or whatever. So. Then I'll mention post-concussion syndrome, and really it's just another injury that occurs from the first one, hasn't gotten better. The biggest thing I like to say is something called second impact syndrome. That's when you get a concussion on top of a concussion, and you don't want that because there's a high risk of death or long-term injury afterwards, okay? So that's why for you, it shouldn't be that much of an issue. Post-concussion syndrome or second impact syndrome shouldn't really come down on my behalf. And I put this one up here, but remember, return to play is our decision, okay? And it makes it pretty easy. Long-term effects, we're still trying to figure it out. We don't know. The NFL doctor was there, and he gave a talk at the American College of Neurology, and they're even seeing these plaques in 40-year-olds. So they don't know if these plaques, they're actually trying to figure out now if these plaques are a normal aging process or actually they're from concussions in some of these autopsies. So I think the going theory is, yes, they are related to some of the damage they had, but there is also some aging process involved. So that's an ongoing study. But once again, you've all seen the stories, and I put them on my Facebook. But when I find them, I put them on Facebook, actually, or Twitter, the NFL stars that have committed suicide or whatever. I put a great one out this week. I don't know if anyone remembers, I can't remember his first name. I think it's Eric Kramer. He played for the Detroit Lions back a couple years ago. He's about 52 now, so he probably played about 20 years ago or so. But unfortunately, he tried to take his life and survived. And that's why I put that story out there, because he's actually normal afterwards. But he was lucky. Unfortunately, the junior Seau's and that kind of stuff are the ones that usually make the press, and they aren't so lucky from it. Return to play, once again, it's easy for you. It's just kind of made by a physician. Guidelines for coaches, just remember, advocate and teach safety first. Okay, you're their best line of defense. And just make sure you talk with the parents and kind of let them know what's going on. And if you have any questions at all, you've always got the trainers out there, and they can be a big guidance to you as well. Okay, you're not by yourself out there alone. If you see me floating around, grab me. I have 3 kids that all play. I'm here, I almost live in the soccer field Monday through Friday, it seems like. So bottom line, we just got to have a high index suspicion. And really a summary, it is a major health issue. The CDC recognizes it. That's why we have you do the online training now, trying to get some awareness out there to you. That's why I came today, just to kind of get some little pieces in your brains that you kind of have some idea of what it is. Like tell folks, if I have a hard time making the diagnosed concussion, it's going to be just as hard for you guys. And I have kids come in every Saturday morning, and I'm not sure if they have one or not. It's really hard. And I've got a lot more tools I can use. It gets complicated. On Friday nights, I can look at their eyes. I can look at their balance. I can look at a lot of things to make that decision. And if it goes beyond that, and there's some new studies out there now that show I can actually bring them in the office. I can put them on a treadmill. I can do heart rate-based exercise testing on them. And if I can't get them to 80, 85%, then I know they should be able to do that, then they've probably got a concussion. So there's some good data coming out on that as well. So I've got a lot more tools that I can use than this being on the sidelines on Friday nights or on your sidelines. So the big thing is any questions for me. It's a lot of information, so.
What's the latest research on heading, teaching headers? Is there a certain age group?
That's what I was trying to clarify before. When I was doing my research online, it looks like a lot of places are making heading under the age of 10 illegal. Right now, there's no good data to suggest heading causes concussions or causes long-term damage. The studies, I haven't looked at the studies myself, but I kind of looked at the gross generalization of it, and there is no confirmed consensus yet. But it looks like they're trying to get it kind of banned under the age of 10. And they're actually I think they're trying to move it up to a little higher. And if that's going to solve anything, I don't know. I'm sure they're erring the side of safety right now until they have some more data and some more studies. The problem is these studies take years to complete. You can't just do one season. You got to go out like the NCAA, go out 5 seasons and track for years and years and years. Unfortunately for our kids, I don't think we'll have that answer. I mean, for their kids, we'll have realized heading is good or bad. Have fun this year. If you have any questions, I'm always at the office Monday through Friday. All right, and then follow us on Facebook if you can. I put a lot of information about that. Myself and 2 of our trainers kind of run it. So we keep it pretty common sense stuff. We don't get out there on it in terms of really detailed research level stuff.